Greetings, my name is Nguyen with the University of California, Davis Emergency Medicine Residency. I will be giving a presentation on the trends in opioid exposures following hydrocodone rescheduling. I have no financial disclosures to make. In 2012, hydrocodone combination products were the most prescribed medication in the United States. Pharmaceutical opioids overall were responsible for the highest relative increase in overdose death rates compared to any other substance between 1999 and 2009. In response to concerns for opioid overprescribing and overdose, the U.S. Drug Enforcement Agency rescheduled hydrocodone-containing products from Schedule 3 to Schedule 2 effective October 6, 2014. The purpose of this study was to evaluate the effect this change had on opioid-related exposures reported to the California Poison Control System. This was done via a retrospective review of all calls to the California Poison Control System. All opioid-related calls to the CPCS from January 1, 2012 to December 31, 2016 were collected, including all ages. Cases were evaluated for the specific opioid involved, the need for evaluation or admission at a healthcare facility, and the final reported outcome, if available. Continuous variables were evaluated by Shapiro-Wilk test for normalcy. Exposures were organized by substance and year of call, and cases involving more than one opioid were included in all applicable groups. For example, a case involving both morphine and oxycodone were included in both counts. Exposure rates were compared to the baseline year of 2012 using Poisson regression analysis. A total of around 16,000 opioid exposures were recorded. 74% of these were referred to a healthcare facility. Median age was 36 years and included ages between 7 days to 99 years old. The majority of patients were between 23 and 54 years of age. Of these cases, 23% were admitted, 15% were admitted to an ICU. We found that there was not a change in the rate of admission over the 5-year period, but did note that there was a decrease in ICU admissions in 2016 compared to 2012. This bar graph represents our data categorized by opioid group and by year and counts. The years are represented by the bars, and on the y-axis is the number of calls related to that opioid in that year. There appeared to be a general trend of decreasing rates of calls for most opioids. Bars labeled in the color red are statistically significantly different compared to the base year of 2012. We found that compared to the first year, there was a significant decrease in hydrocodone exposures in the 2 years following its rescheduling. Similarly, there were generally decreases in exposure calls involving morphine, oxycodone, methadone, and other opioids such as loperamide. We did note that there was a significant increase in codeine exposures in 2015 and 2016. Additionally, of all the groups, tramadol was the most commonly reported opioid exposure in all study years. Significant increases were noted leading up to the rescheduling of hydrocodone. When all opioids were grouped together, there was not an overall change in opioid exposures during the study period. Because of the nature of the data available to the California Poison Control Center database, we were limited in what types of data could be extracted. A lot of the data is dependent on healthcare provider experience and decision to report to the Poison Control Center. What final outcome data is available is dependent on repeated follow-ups, and oftentimes we did not have final outcome data. Most data beyond the type of opioid, date, and age was limited. In summary, there was a decrease in hydrocodone exposures after its reclassification in 2014. There was a marked increase in codeine exposures and no overall change in the overall calls regarding opioid exposures to the California Poison Control System. With this, it suggested that while the intended effect on hydrocodone was observed, there may have been an unintended consequence of a shift in prescribing patterns to less regulated opioids. This concludes this presentation. Thank you for your time.